Countries like the United Kingdom, Denmark, Sweden, they've begun lifting nearly all COVID-19 public health measures. Is Canada next? At least one province says it's ready to make that move.
There's been a lot of discussion lately about whether it's time for us in Saskatchewan to look at ending all of the remaining COVID measures and restrictions that we have in place. Well, I think it is time. That's what I am hearing, and that's what our MLAs are hearing from most of their constituents.
Mona Nemer is Canada's Chief Science Advisor. She's in Ottawa. Dr. Nemer, welcome back to the show.
Thank you.
I want to start with the big picture if we can. We've seen several countries in Europe, they've started to lift their COVID-19 restrictions while others have done away with them entirely. At what point do you think Canada can start doing something like that?
Well, we're starting to see already several provinces lifting a number of measures. Remember that Europe's wave started before us, so they have peaked. Hopefully we have peaked, but the peak is still very high and we're not seeing yet the descent. But I expect that, as usual, we will be, few weeks of months after Europe, and we should be in a position to lift most measures shortly.
Right, so just because Europe is doing it doesn't mean we should immediately follow suit because they're further ahead on the curve of this particular wave.
Yes, well, there is, that's very important. The other thing that's also important to remember is that we have these public health measures to protect our healthcare systems. And our healthcare systems, especially ICU beds in our hospitals, are lower per capita here than in many of Europe's jurisdictions. So that also is a factor that needs to be considered.
Okay, so as you mentioned, some provinces are already doing this. When different provinces are going to take different approaches. I mean, what should be the indicators that we look for in order to start lifting restrictions? Does it boil down to that ICU capacity and hospital capacity that you mentioned?
Well, I think that's an important one, but it's also the more that we learn about the virus and how we're overcoming it, I think the more comfortable we're going to be in taking risks, right? So right now we have quite a few tools for a virus that's been with us for only 2 years. So we have vaccines that still work very well, very effective, especially if you have your booster. And we have also starting to see therapeutics. We know how to manage the disease much better in hospitals and out of hospitals. So I think these are all very important factors as well that make us more or less, more comfortable in a way in taking calculated risks, I would say.
Dr. Theresa Tam, among others, have made the point that Omicron cases appear to have peaked in Canada. I mean, what does that tell us in terms of where we are on our way out of this pandemic?
Well, the peak can be there for a long time, or it can come down very quickly. Right now, it's difficult for us to tell really what's going on because testing is not available to everyone. However, if we look at some indicators like testing for the virus in wastewater, we're starting to see levels come down. This being said, of course, we have to wait and see what the reopening of many sectors of the economy are going to bring for the coming couple of weeks and take it from there. I think that we're on the right path, but hopefully we won't find bumps in the way.
On the right path, and also in a much different situation than we were in previous waves. We've got vaccines, antiviral treatments, getting the access to rapid tests. But despite all that, we saw how Omicron just ripped through the country, right? So how prepared do you think Canada could be for another variant, should there be one?
We definitely need to learn from the Omicron lesson and up our surveillance. The fact that we had a variant is really not surprising. And right now that we are going to see other variants, and whether they're going to be more or less virulent, only time will tell. So it's very important that we have a surveillance system that allows us to detect new variants of the virus. It's important that we maintain preparedness in terms of our own immunity by staying up to date with our vaccination schedules. But it's also important that we put to work the lessons learned about how the virus spreads. And we know now that it spreads mostly by air through aerosol and droplets. So paying attention to the ventilation, upgrading our ventilations in public places, in schools, in long-term care homes is going to be very important for the coming months.
You know, cases have peaked, but we're still in the depths of winter. I remember around this time last year when Dr. Tam could point to cases coming down, the weather getting better, more time outdoors, you know, as sort of a bit of hope and some optimism of where things were going. I mean, use your crystal ball if you can. I mean, how do you see things playing out in Canada over the coming next few weeks and months?
You're asking a scientist to use a crystal ball. That's counterintuitive, but I'll tell you, if we look at how things have evolved with other viruses, for example, with other human coronaviruses that have been with us for thousands of years, and the influenza virus as well, I think we can expect that as time goes on and we have better immunity for the virus, that we're going to be able to coexist in more harmonious way, if you want. And let's remember that humans have coexisted and conquered many viruses over the years. So I am cautiously optimistic, but I don't think that we can let our guards down. I think that we need to keep doing research for understanding better and better how the virus is evolving. We need to have more antivirals, we need to have more medications, and we need to have a solid surveillance system to alert us when at the earliest indication that we have a new variant among us.
Okay. Dr. Nemer, thank you so much for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.